What's everybody's plan when the Mounjaro savings card expires in June? Hi, I'm Jenna. I'm a board certified family and obesity medicine doctor. I incorporate a lot of obesity medicine into my family medicine clinic, and I'm going to speak generally on how I think about this topic today. But remember, this is not medical advice, and you are going to discuss with your physician what is best for you in your circumstance. If I have a patient who's been doing really, really well in Mounjaro, then the obvious thing to switch them to is an alternative GLP. Any GLP that we can get their insurance to cover. So that may be Trulicity or Ozempic or Wegovy or Saxenda or Victoza, and we will be happy with any one of those. Yes, they show different amounts of weight loss in the trials, and some may be better tolerated, but we know that GLP-1 medications are overall the most effective medication option that we have for obesity treatment. If it is possible to get somebody an alternative is totally dependent on their insurance. And we can go about that two ways. We can try and get medication that is FDA approved for obesity, but a lot of insurances have an exclusion for this because they consider obesity cosmetic. If somebody does not have obesity treatment coverage, then we have to look at what other diagnoses a patient may have that may allow for off-label usage of anti-diabetes GLP medications. So things like PCOS, hyperglycemia, insulin resistance, metabolic syndrome, prediabetes, all these may allow with some insurance plans for off-label use of the anti-diabetes medications like Ozempic, Trulicity, Victoza. Compounded GLP medications like Ozempic are also an option. I don't like them as an option. I think they're too risky overall, but I do understand that for some people, for some patients, that the risk may be worth the benefit depending on how many comorbidities they have and how much good the medication is doing in their life. So that is something you'll have to discuss with your doctor. I'm not going to speak much on compounded GLPs. If somebody is able to afford the GLP-1 medications from Canada, then that is a great option. It's still an expense, but it's not much more of an expense than the compounded medications, and it's safer. Any US doctor can write a prescription and the patient can themselves take it to a Canadian pharmacy. They can upload it or we can fax it there. So that's a great option. I think come June, it may be important to switch from the mindset that we're going to keep trying to lose weight to we're going to try and maintain the loss that we've had, and that's okay because insurance coverages will change and hopefully they will become more and more inclusive for the medications that we want on there. And I think they will because everybody is fighting like hell to get these medications now on their plans, and that's really, really good. Also, better things will come out. More medications are in the works and things will change. So maybe the goal is just to maintain the loss that has happened until another opportunity comes our way. Medications like phentermine and Qsymia and Contrave and metformin are not as effective in trials, but they still can be really effective for some people, and they may just be enough to help prevent the regain. Ozempic from Canada is another option. And yes, it is an important point that the Ozempic from Canada does not go up to the same dose. So if you're on a higher dose here, if you go back to a lower dose, it may not be as effective, but it may be enough to prevent regain. And maybe that just needs to be the goal for a while. With obesity treatment, this is a long-term thing. So to go into more of a maintenance phase for a while until another opportunity comes our way, I think is okay. Better medications are coming out, and I do think there'll be more savings cards. Hopefully insurance formularies will become more inclusive. I know people are bringing to the attention of their employers who are choosing these formulary plans that it's very important to them to have anti-obesity coverage. And I just really do believe that we're going to see this become more mainstream. So yeah, those are my thoughts.